Mike Glenn get some credit and props today because it's been a tough process for him getting through a lot to manage with the construction, and one of the toughest areas for him was trying to get physicians excited. And this is a little bit of Mike was facing the administrators are from Mars, physicians are from Venus situation, which is we are notoriously guarded with our feelings. We try to train ourselves. We're never shocked or surprised. If you're ever, taking care of a, let's say, a U.S. congressman who suddenly has pink and green nail polish, you need that poker face at that moment. It's very important. So Mike has really wanted to get providers fired up, and you can just imagine him, coming into a room full of clinicians and saying, "This is going to be great," and getting back. Yeah, it seems interesting, and that's the truth. And the truth is, providers, we sometimes overlook the setting in which we are providing care. And any of my 60 to 80-year-old male patients in the audience will attest to this. If you ask them how many times they've had to read Oprah magazine or Fit Pregnancy while waiting for me in the waiting room, my attention may not be as focused on the setting that we're providing care. And the reason sometimes we're not so focused on the setting of care is because we are laser focused on the relationships we have with patients and the interactions we have with those patients. Those relationships are really the foundation of our work. There are many of our clinical staff, physicians, nurse practitioners, physician assistants, nurses, medical assistants, technicians, and they have been willing to provide care in this community in a variety of settings and conditions. There are many of us who have cared for patients in their homes, in hospital rooms, in clinic exam rooms, in the exam room that had recently been a storage room, during a power outage in a room that had once been a storage room that was now an exam room with electric lanterns glowing. There are enough staff in this organization who have actually worked out of a broom closet. There are enough people who could raise their hand to that we could actually form a softball team for the hospital. Done it. And we have a large and growing need for quality, comprehensive medical care in this community, and we have been filling every nook and cranny of this campus with people on a mission to meet that need. And in the past few years, we have truly stretched things to the limits. And while we can put up with a lot, we start to get frustrated when the environment begins to interfere with the kind of care that we want to provide. 2 weeks ago, I came down to the emergency room to find the staff working to help calm and stabilize a patient in a mental health crisis in the midst of a completely full department. It was amazing to watch the staff exhibit such calm, compassion, professionalism as they were faced with the situation of not having a room to place the patient in. Some staff were working to keep the patient safe in front of the nursing station, while other staff were attempting to shuffle and rearrange the patients who were already in the emergency department. This meant our staff, including our petite but very pregnant emergency room physician, trying to squeeze by stretchers and equipment to get from one point to another. And while our staff navigated the situation with grace, as they always do, it was impossible to not observe that the capacity of the existing facility had been surpassed. And what took place that day was not an unusual occurrence. This is something we have been dealing with for a while. And when we struggle to find space to accommodate patients and their families, to ensure privacy, or to provide quiet respite, then we need to find a better solution. Patients seek our help when they are hurting, when they are scared, and the path to that care they seek should not be difficult to navigate. It should be helping their cause, not detracting from it. We want a place that helps us serve our patients in this community to the best of our abilities. We have a staff that prioritizes patient safety and care first and foremost. They have come here to work for and often reside in our community. They have committed their time, their energy, and their compassion. And our community has responded as well with a commitment of their own. They have increasingly sought our services over the last decade. They have put their faith in us to help them heal and help them stay well. It's time for us to take another step in our journey to becoming a stronger and better healthcare provider. This building is the result of the commitment between our organization, our patients, and the residents of Jefferson County. I mean no offense to the fine construction team, but this building was truly built by all of you. It is the product of hard work, growing, adapting, and always looking to improve. The heart of this organization and the people who work in it is huge. I don't think you could build a building big enough to fit it, but I know this building will serve it much better. Thank you.